Hi, I'm Christina Lindemann, a PA specializing in neurology at UC San Diego Health. I'm looking forward to talking with you today about some important topics related to migraine. In this video, we are going to talk about how migraine disease impacts our patients and why it is underdiagnosed. In our subsequent videos, we will characterize and differentiate types of migraine, identify the phases of a migraine attack, discuss diagnosis, and finally, I'll share some tips regarding patient education and treatment. As you can see, there's a lot of ground to cover, so let's dive in. Migraine is a very common neurological disease, affecting more than 40 million people in the United States alone. It is about 3 times more common in females than in males, and is most common between the ages of 25 and 55. Migraine is a primary headache disorder, meaning that its symptoms are not attributable to or secondary to another condition. The disease itself causes activation of pain pathways versus activation by secondary causes such as a brain tumor, vascular lesion, medication side effect, or infection. Migraine is a complex disorder with several genetic pathways driving disease in different individuals. Even as common as migraine is, and regardless of the advancements in diagnosis and treatment, migraine is still underdiagnosed. There are many reasons for this. For one, migraine is associated with a wide variety of symptoms. These symptoms are not the same across all individuals. To complicate things further, sometimes even a single individual may experience different symptoms with each migraine attack. Additionally, the diagnostic criteria for migraine, which we will discuss in another video, require a combination of symptoms. However, some of the symptoms we most commonly think of, such as aura, throbbing, or severe pain, are not always requirements for diagnosis. The symptoms of migraine can also overlap with other conditions, leading to misdiagnoses such as sinus headaches or sinusitis, tension-type headache, or cluster headache. Finally, patients often struggle to make the link between their symptoms and may not share all the symptoms they are experiencing unless they're directly asked. The time between symptom onset and diagnosis is 3.3 years on average, so patients are often experiencing the pain and disability of migraine for years without proper treatment. I'm not using the words pain and disability lightly. Migraine has a significant impact on patient quality of life. In fact, more than 85% of patients with migraine report impaired sleep, and 50% of patients feel fatigued either often or always. 85% of patients report being very or extremely limited in completing their daily activities when they are in the headache phase. And it's not just feeling tired or fatigued, it's the worry that comes with it. 30 to 60% of patients report being concerned about long-term financial security. About 20% indicated that migraine has contributed to relationship problems. And about 40% feel that they would be a better parent if not for migraine. I do want to take this opportunity to mention migraine stigma. A majority of patients with migraine disease report experiencing migraine stigma, and the incidence increases the more headache days an individual experiences. Stigma is a contributor to disease burden for our patients, as they experience blame and shame for the perception that they are avoiding responsibilities and not participating in their life roles. As PAs, we can help to overcome some of the stigma our patients face by taking the time to better understand migraine and addressing any biases we may have. Primary care clinicians are uniquely suited to help overcome the challenge of migraine underdiagnosis. In fact, 70.3% of patients who seek care for migraine seek this care from their primary care provider. PAs in primary care have the opportunity to really understand their patient's symptoms and critically evaluate appropriate diagnosis. In my next 2 videos, I will discuss the phases of migraine, characteristics and symptoms that might lead us to suspect migraine, and the tools and criteria to diagnose. We'll see you there.